rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today I saw a patient with metastatic renal cell carcinoma who was being evaluated before first-line systemic treatment. He asked, "Doctor, how high is my current prognostic risk?" Rather than relying on a single model, let's take a closer look. Our patient has metastatic renal cell carcinoma. His Karnofsky performance status is below 80%. It has been at least 1 year from diagnosis to first-line systemic treatment. His hemoglobin is below the institutional lower limit of normal. He also has elevated corrected calcium, an elevated absolute neutrophil count, and an elevated platelet count. His LDH is above 1.5 times the institutional upper limit of normal. Let's assess his risk using the Renal Cell Carcinoma Prognosis Panel in the OncoToolkit. This panel evaluates the patient using 2 established prognostic models in parallel, the IMDC, or Heng, criteria, and the MSKCC, or Motzer 2002 criteria. The 2 models are calculated separately with no combined score. Let's enter our patient's information. First, is the KPS below 80%? Yes. Next, is the time from diagnosis to first-line systemic treatment less than 1 year? No. It has been at least 1 year, so we'll select our next. Is hemoglobin below the institutional or sex-specific lower limit of normal? Yes. For the IMDC criteria, is corrected calcium above the institutional upper limit of normal? Yes. Is the absolute neutrophil count above the institutional upper limit of normal? Yes. And is the platelet count above the institutional upper limit of normal? Yes. Now for the MSKCC specific criteria. Is corrected calcium above 10 milligrams per deciliter? Yes. Finally, is LDH above 1.5 times the institutional assay upper limit of normal? Now let's calculate the results. Here are the results. The 2 models are displayed side by side. The IMDC score is 5, placing the patient in the poor risk group. The MSKCC score is 4, also placing the patient in the poor risk group. For the IMDC model, the historical 2013 first-line VEGF-targeted external validation cohort reported a median overall survival of 7.8 months for the poor risk group. These are historical cohort observations, not individualized survival predictions or treatment selection rules. Under calculation logic, we can review which criteria contributed to each model. Importantly, IMDC and MSKCC remain separate prognostic systems. The panel presents them side by side rather than combining their scores. For convenience, the assessment can be copied or saved within the platform. If you'd like to learn more, scroll down to the reference data and clinical workflow sections for additional guidance and supporting evidence. For this patient, both models classify the disease as poor risk. These results provide prognostic context and should be interpreted alongside the patient's overall clinical picture and current treatment guidelines. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.